San Diego County is having the biggest COVID surge since last summer. In 3 days, the county confirmed more than 17,000 new cases, and hospitalizations are up too. Over 700 people are hospitalized with COVID. Chris Van Gorder, the president and CEO of Scripps Health, says their hospitals are filling up fast.
Oh, we're seeing a significant increase in cases. On Christmas Eve, we had 80 COVID patients hospitalized at our Scripps facilities. Today, we have 210. So that's an increase of 130 COVID patients just in 11 days.
But this surge is different.
In fact, my employee health department told me this morning that they're getting calls between 6 and 8 employees are calling, telling our employee health that they tested positive per hour.
And now they're canceling elective surgeries.
I had 5 medical surgical beds available in the entire healthcare system, but I had 19 patients waiting for beds just at one of my hospitals.
And they're not the only hospital overwhelmed by COVID. On Monday, so many hospitals asked to be put on emergency diversion, the county removed that option altogether.
So that means that all those ambulances that would normally bypass us because we don't have the staff are coming to our hospital and dropping off the patients anyway.
Dr. Scott Herskovitz, the clinical director of the ER at Rady Children's Hospital, says parents should call their pediatrician or their hotline to pre-screen them before they go to the ER.
A lot of the kids who are coming to the emergency department are really having mild to moderate illness and aren't necessarily needing to be admitted to the hospital for any significant care. It's just the sheer volume of patients that we're seeing is kind of causing strain on the system itself.
And that's the message for everyone. Call your doctor and don't go to the ER for a COVID test or if it's not an emergency.
But if you're coming for something that is a less priority, you're probably going to have to wait a long time. And if you need admissions, you may be waiting in the emergency room for potentially hours to days.
And if you do, please be patient with those who are caring for you.
And people are literally attacking and yelling and screaming at the people that are trying to help them. So we've literally had to start de-escalation classes for our doctors and nurses to teach them how to de-escalate people that are hostile when those people came in to get care from us. So it's a very, very difficult time for people in healthcare.
Kitty Alvarado, KPBS News.